All right, everybody, Dr. Rafich here from Vet Triage. We are continuing on with this issue of JAVMA from June 1st, 2015. Pathology in practice. Look at that, that's gross. That is a catfish there. We're going to talk about catfish. This picture shows a posterior kidney mass. There's an arrow there pointing to the mass. Not the best image, but there you go. So this is a 9-month-old stock or catfish from Mississippi. They euthanized and performed necropsy after several hundred fish on the farm had died. The catfish is Ictalurus punctatus. They found a 3 centimeter diameter spherical firm, smooth, pale pink posterior kidney mass noted, and this study comes out of the vet school in Louisiana State University as well as the vet school from Mississippi State University. And here's the images of cytology. You can see that there, and I also have the pictures over here for that. So we're going to go through those. They are labeled as well. So what you're seeing in the picture is an impression. The top one is the impression smear of the posterior kidney mass. Note the mature spores in pairs. Those are arrows. So right there, look at that. Those are spores in pairs. And immature trophozoites, which are the arrowheads, right there and right there. Pretty cool. And then lymphocytes, which are labeled L, and then macrophages, which are M. All right. And the bottom picture, this is histology here, so biopsies. Posterior kidney mass, normal kidney architecture is effaced by plasmodia, characterized by developing stages of myxozoans, which are arrows. So these are myxozoans in here. With necrotic debris, mature spores, which were arrowheads. There you go, right there. Look at those things. They're so unique. Mature spores, arrowheads with elongated polar capsules are seen. Okay, cytological and histopathologic findings. The smears show abundant microorganisms in various stages of development with few inflammatory cells. Immature trophozoites, along with numerous mature spores, are seen. The trophozoites are round to oval and 4 to 7 micrometers in diameter. They're found both singly and in aggregates. Each contain a round purple nucleus with a small amount of deeply basophilic and occasionally vacuolated cytoplasm. The mature spores were found singly as well as frequently in pairs. They have elongated bodies measuring 20 by 5 micrometers that contain 2 anterior magenta piriform polar capsules and a single posterior clear round vacuole. I mean, this is exactly it, right? That's exactly what it looks like. The polar capsules were characterized by approximately 6 to 10 internal polar filament coils. The organisms also had long tapering tails with indistinct endings that were approximately 20 to 40 micrometers in length. Few oval structures were noted that contained both trophozoites and developing spores with developing polar capsules. The inflammatory cells consisted most of macrophages and few lymphocytes. Let's see. Okay. The mass is composed of densely packed plasmodia, which are pseudocysts containing myxozoans of various stages of development. The pseudocysts were round to oval and highly variable in size, approximately 30 to 500 micrometers. They have a thin outer eosinophilic hyaline membrane and contain abundant eosinophilic fibrillar to granular necrotic debris with developing trophozoites and spores similar in morphology to those in the impression smears of the mass. There are moderate numbers of macrophages and lymphocytes in the surrounding renal tissue along with rare myxozoans. Microscopic examination of gill mount preparations also reveal few plasmodia along with few trichodynia organisms. Results of bacterial culture of brain and kidney were negative. So the morphologic diagnosis and case summary was moderate interstitial granulomatous nephritis with abundant mixozoans consistent with Henneguya organisms in a catfish. Okay, now to get into it. Comments. The genus Henneguya belongs to the phylum Myxozoa and the class Myxosporia. The Myxosporians are common parasites of a wide range of teleost fish and invertebrates worldwide, with a few species found in Elsmobranches, amphibians, and reptiles. There are at least 204 species in the genus Henneguya, with 43 new species described between 2002 and 2012. You can tell, obviously, I've had no experience with this parasite, but I also don't really work on fish outside of vet triage. Their life cycle is complex and involves the development of actinospore in intermediate hosts, such as an oligoket. Sorry, guys, 1 second. The infective actinospore, after being discharged from the intermediate host, then penetrates the piscian host via the skin or gill epithelia, commonly via mucous cells. It has also been reported that the buccal cavity and the stomach were important sites of entry after experimental infection of channel catfish with Henneguya Ictaluri actinospores. Infections with various Henneguya species in channel catfish, such as Ictaluri punctatus, have been reported. These parasitic organisms can be devastating to the catfish farming industry, with mortality rates as high as 100%. Holy crap. Losses occurring among both fingerlings and market-sized catfish. Clinical signs in channel catfish infected with Henneguya species vary depending on the infected species. Catfish infected with Henneguya ictaluri, the causative agent of proliferative gill disease, develop gill thickening, necrosis, and hemorrhage secondary to intense granulomatous bronchitis, which, okay, there we go. Let's see. Secondary intense granulomatous bronchitis, which results in reduced oxygen exchange. Infected fish are lethargic and swim near the water's surface, presumably owing to hypoxia. Interestingly, although proliferative gill disease does not appear to be host-specific, the blue catfish, Ictalurus furcatus, experimentally infected with the parasite, had lower morbidity and mortality than did channel catfish and channel crossed with blue catfish hybrids in one study. Inflamed plasmodia were not detected in blue catfish, indicating that the parasite was unable to complete its life cycle in those fish. Other Henneguya species have been reported to cause cutaneous masses in channel catfish, with Henneguya diversus infection also resulting in cyst formation in liver and kidneys. Definitive diagnosis of Henneguya infection relies on identification of the typical spores, although the spores are not always readily observable, and secondary inflammation. The spores can be visualized via microscopic evaluation of sustained wet mount preparations or impression smears stained with right JAVMA stain, or histologic examination of formalin-fixed tissues stained with H&E or JAVMA stain. The species can also be determined by sequencing the 18S small subunit rDNA after isolation and PCR amplification, and comparing that sequence against the several known 18S small subunit rDNA sequences of Henneguya species. Traditionally, you figure out what species it is via detailed measurement of the spores in wet mount preparations and the tissue and host predilection of the organisms. But you can also measure the 18S small subunit, the rDNA, or sequence it rather. With regard to this case report, differentials include cancer or granuloma caused by fungi or parasites. There is no effective treatment. However, supportive care with increased oxygenation to the water can be implemented. Furthermore, it has been shown that channel catfish with lesions due to experimentally induced proliferative gill disease can heal with minimal residual damage after they've been removed from infested ponds. On the basis of the findings for the case reported here, water oxygenation in the fish farm tanks was enhanced by increased aerator use and decreased feeding to decrease oxygen consumption. Wow, really bizarre treatment. More oxygen and less feeding. Interesting. Well, there you go. For those who care about fish, this is a cool one to know about. I certainly have learned a ton from this one. And yeah, we'll see you guys then in the next video. Take care.